We all recognise that we have a social care crisis in the system, and society should be judged on how they treat the most vulnerable. According to Age UK, our social care system is underfunded, a postcode lottery, and is simply not meeting the needs of those most in need. Local authorities do provide some adult social care, but in England, if you have savings and assets of more than £22,000, you pay for everything. Since 2010, councils in England have had the money they receive from central government cut nearly in half as part of the government's austerity measures. 1.5 million people aged 65 plus don't receive the care and support they need with essential living activities. A 2017 report by the Competitions and Markets Authority estimated that on average, self-funders paid £44,000 a year for a care home place. The NHS has warned before the pandemic that it was 100,000 staff shortage in the social and healthcare workforce. This problem has only been exacerbated by the coronavirus pandemic. Successive governments have tried and so far failed to resolve this challenging and growing issue. Well, Prime Minister Boris Johnson has pledged to end the catastrophic cost of social care. But his grand idea is to resolve it by hiking up taxes on working-age people, breaking his 2019 election manifesto promise to not increase national insurance contributions. Number 10 is said to be in favour of a 1% rise, but the Treasury is reportedly pushing for a 1.25% rise. The Health Secretary, Sajid Javid, calls for a 2% rise in national insurance to fund social care. This will see ordinary people paying, on average, hundreds of pounds extra in tax each year. But this is already causing big rifts. According to The Telegraph, Jeremy Hunt, the former Health Secretary who now chairs the Commons and Health Social Care Committee, stated, a rise in income tax feels very unconservative after the progress in reducing it during the 1980s, and national insurance disproportionately targets the young. The Labour Party leader, Keir Starmer, has ruled out supporting the increase in national insurance contributions to fund the social care crisis. There is no dispute over the problem, but there are big questions about the solution. Is this particular policy fair and sustainable? We have an ageing population, so the cost is only going to get more expensive, and therefore a smaller proportion of the population will be paying for a growing proportion of the population. Should young people, working-age people, be paying for something they are significantly less likely to use, as pension age and national insurance is not paid by people above pension age? Is there a guarantee that the money raised is going to be spent on this particular issue? Rather than a tax on employment, have we considered a tax on earnings, be that earnings from pensions or rental income too? This issue must be addressed, but there are big questions over whether increasing the tax burden on a generation that is already locked out of the housing ladder, experiencing low-paid and precarious employment, is really the best type of policies to bring about the intergenerational solidarity that we so desperately need. We absolutely need to resolve this issue, but is this really the right approach?